G'day, my name's David. I'm one of the partner physiotherapists at myPhysioSA. This is one of our instructional videos. I'm going to be talking about acute knee injuries, so either sporting injury or a trauma to the knee. So when the knee is put under extreme stress or rotating forces or loading forces, you can actually do damage to different structures around the knee. I've just removed the patella. We won't talk about that today. What we're going to talk about is ligament damage or cartilage damage in your knee. So there's a few ligaments around the knee. The most common one would be, especially the most common to get injured, is this big long one which sits on the inside of the knee. So this is a right knee. This is called your medial collateral ligament. It's really long and thick. It can get ruptured or torn or strained when the knee collapses. So that means it's collapsing or twisting in. It's quite a common sporting injury for especially footballers. If you get struck from the side or you get someone landing on you or you twist and push off, you can cause trauma to this ligament. The outside ligament is your lateral collateral ligament. It's less likely to be injured just due to the way you'd have to fold under with your foot underneath your knee, but they can definitely get torn or badly strained, and they sit right on the side. The worst ligaments to damage are your ACL and then your PCL, and they're internal ligaments, and they control the shearing of your shin bone on your thigh bone. So when these rupture, especially the ACL, it causes instability in the knee, which means from then on there's a good chance you might not be very stable with side-to-side lateral movements, the sorts of things you need to do to play sport at any level really. So there's a lot of people that will need surgery if they want to continue playing sport. The PCL sits a bit further at the back. We've already pre-ruptured that one, and that they don't tend to do any operations or surgeries. It tends to scar up, and it doesn't affect your stability quite as much as the ACL, and you can normally cope with damage to your PCL. The last lot of structures are your cartilage. So they're called your meniscus is the proper name. You've got your medial and your lateral meniscus, and they can get little tears in them, and that's from loading with a compression down and a twist normally, so like a grinding force on them, and you can get an acute tear of your meniscus. So all of these injuries can potentially all happen at once, or you can do an individual ligament or a cartilage. They can be a bit tricky to diagnose exactly what you've done. Seeing a physio will definitely run a barrage of tests on you and see how well the knee is moving, what sort of stability and strength you've got. We test the ligaments by gliding them, do our cartilage tests. If we're thinking it's going to heal up, we'll set you up with a conservative management program and make sure they heal up and you rehab up, back to return back to sport as quickly as possible. And if the physio has concerns that you've done a very good job of it and it might need to be scanned and or a specialist to be reviewed, then we will sort that out for you. Okay. So knee injuries are very, very common. They're traumatic ones normally take 6 to 12 weeks to get better depending on the level of the strain or the tear that you've done. So definitely see a physio and get the right diagnosis and the right plan from there. Okay, thank you very much.